Welcome to this podcast on Air Quality Index. An Air Quality Index or AQI is used by government agencies to communicate to the public how polluted the air currently is or how polluted it is forecast to become. Public health risks increase as the AQI rises. Different countries have their own air quality indices, corresponding to different national air quality standards. Some of these are the Air Quality Health Index of Canada, the Air Pollution Index of Malaysia, and the Pollutant Standards Index of Singapore. Let's take a look at the Air Quality Center. The computation of the AQI requires an air pollutant concentration over a specified averaging period, obtained from an air monitor or model. Taken together, concentration and time represent the dose of the air pollutant. Health effects corresponding to a given dose are established by epidemiological research. Air pollutants vary in potency, and the function used to convert from air pollutant concentration to AQI varies by pollutant. Its air quality index values are typically grouped into ranges. Each range is assigned a descriptor, a color code, and a standardized public health advisory. The AQI or air quality index can increase due to an increase of air emissions. For example, during rush hour traffic or when there is an upwind forest fire, or from a lack of dilution of air pollutants. Stagnant air, often caused by an anticyclone, temperature inversion, or low wind speeds, lets air pollution remain in a local area, leading to high concentrations of pollutants, chemical reactions between air contaminants, and hazy conditions. On a day when the AQI is predicted to be elevated due to fine particle pollution, an agency or public health organization might, number 1, advise sensitive groups such as the elderly, children, and those with respiratory or cardiovascular problems to avoid outdoor exertion. Or 2, declare an action day to encourage voluntary measures to reduce air emissions such as using public transportation. Or number 3, recommend the use of masks to keep fine particles from entering the lungs. During a period of very poor air quality such as air pollution episode, when the AQI indicates that acute exposure may cause significant harm to the public health, agencies may invoke emergency plans that allow them to order major emitters such as coal burning industries to curtail emissions until the hazardous conditions abate. Most air contaminants do not have an associated AQI. Many countries monitor ground level ozone, particulates, sulfur dioxide, carbon monoxide, and nitrogen dioxide, and calculate air quality indices for these pollutants. The definition of the AQI in a particular nation reflects the discourse surrounding the development of national air quality standards in that nation. A website allowing government agencies anywhere in the world to submit their real-time air monitoring data for display using a common definition of the air quality index has recently become available. In India, the National Air Quality Index AQI was launched in New Delhi on September 17, 2014 under the Swachh Bharat Abhiyan. The Central Pollution Control Board, along with state pollution control boards, has been operating National Air Monitoring Program NAMP, covering 240 cities of the country, having more than 342 monitoring stations. An expert group comprising medical professionals, air quality experts, academia, advocacy groups, and SPCBs was constituted, and a technical study was awarded to IIT Kanpur. IIT Kanpur and the expert group recommended an AQI scheme in 2014. While the earlier measuring index was limited to 3 indicators, the new index measures 8 parameters. The continuous monitoring systems that provide data on near real-time basis are installed in New Delhi, Mumbai, Pune, Kolkata, and Ahmedabad. There are 6 AQI categories, namely good, satisfactory, moderately polluted, poor, very poor, and severe. The proposed AQI will consider 8 pollutants: PM10, PM2.5, NO2, SO2, CO, O3, NH3, and PB, for which short-term up to 24-hourly averaging period national ambient air quality standards are prescribed. Based on the measured ambient concentrations, corresponding standards are likely health impact. A subindex is calculated for each of these pollutants. The worst subindex reflects overall AQI. Likely health impacts for different AQI categories and pollutants have also been suggested, with primary inputs from the medical experts in the group. The AQI values and corresponding ambient concentrations or health breakpoints, as well as associated likely health impacts for the identified 8 pollutants, are as below. Good, 0 to 50, satisfactory, 51 to 100, moderately polluted, AQI range from 101 to 200, poor, AQI range from 201 to 300, very poor, AQI category range from 301 to 400, and severe, AQI category range from 401 to 500. A AQI of 0 to 50 or good means minimal impact to health. An AQI range of satisfactory or 51 to 100 means minor breathing discomfort to sensitive people. A moderately polluted or 101 to 200 AQI range means it may cause breathing discomfort to people with lung disease such as asthma and discomfort to people with heart disease, children and older adults. A AQI range of 201 to 300 or poor means it may cause breathing discomfort to people on prolonged exposure and discomfort to people with heart disease. A AQI range of 301 to 400 or very poor means it may cause respiratory illness to the people on prolonged exposure, and the effect may be more pronounced in people with lung and heart diseases. A AQI score of severe or 401 to 500 means from health impact perspective, it may cause respiratory impact even on healthy people and serious health impacts on people with lung or heart disease. The health impacts may be experienced even during light physical activity. So let's take a look how can we stay healthy when the air quality is poor. We should stay indoors as much as we can with the windows and doors closed. If we have air conditioning, run it continuously, not on the auto cycle. It's also helpful to close the fresh air intake so that smoke doesn't get inside our house. If our system allows for it, we can install a high efficiency air filter classified as MERV 13 or higher. We should avoid frying food, which can increase indoor smoke. We should avoid strenuous outdoor activities like exercising or mowing the lawn. We should try to curb on smoking cigarettes. Exercising outdoors can be a way to stay healthy. During the 101 to 150 range, the air quality index is probably the highest level and up to which we should be able to exercise outdoors. During these COVID times, we can also try to wear masks, like an N95 respirator mask, if worn properly, can filter out some of the particles. But it does little to protect against harmful gases in wildfire smoke, for example like carbon monoxide. The looser facial coverings some of us wear nowadays to lower our risk of spreading or becoming infected with the COVID will provide negligible protection against wildfire pollutants. Thank you very much for listening to this podcast on AQI, one of the most important indexes for climate change today.